and us over here in New York. But what time do you have to wake up in the morning in order to get a workout? That's the best. That really makes it doable. Good, good. No, no cases today. Just setting up stuff for next week and the months to come. Some orthognathics, and it's crazy the amount of preparation that goes into some of these orthognathic cases, where you have to combine it with the orthodontics team. If the patient's not ready, they're not ready, and then they get delayed again. And it's like, no, it's unfortunate. Like you might be working with a patient your entire chief year or what have you, and you might never get to do their surgery, and then the next resident inherits the case. It's Yeah, exactly. Like they just meet someone and walk in and do the surgery. So it's
Year starts and it's like it's time to go.
That's how it goes. Yeah, you either get lucky or you get unlucky. That's how it's like one way or the other. A DSO, like is DSO? A DSO.
Clearly, you can tell.
How did you want to record this, by the way, just real quick?
What happened?
How did you want to record this for the?
I'm thinking that's kind of how we do it.
Okay. I've never done like a post of an Instagram live before. So cool. All right. How was your day? How often do I do these live? Actually, I don't do many Instagram lives. I usually just do TikTok because I don't even know. I don't even know why. It's just pick one and not the other. I don't know. Yeah. I just did the 53rd episode last night. I just saw it on TikTok live. I say like ask any question in the title thing and just off to the races. And then I record it with Riverside in the back, so I could post that later to podcast, YouTube, and I just keep moving.
Do you feel like you get more people viewing you on that versus
probably at this point over there? Yeah.
Damn, man, it's crazy. But do you feel like most of the people are like in the United States or like where are they from?
On the TikTok lives, yeah. I think most people are from the United States, believe it or not. Yeah.
Crazy.
Yeah. Have you done many of the Instagram lives?
Any sort of Instagram, say about 2.5 years, right?
Yeah.
And beginning of this year, I tried it out again, and I was able to do it. So I said, I'm going to make it a point to do these regularly. I mean, I actually connected to a couple clients too. I've done like 5 lives since then, but I've gotten 2 clients because of these lives. Yeah, it's incredible, actually.
How about that? I wouldn't have expected that from the lives. Wow.
I did not expect. It was pretty cool,
So you must have been talking about marketing for dentists, dental practices, dental something.
Yeah, it worked out in my favor to a dentist. So it's weird how this works out. It's awesome.
That's very unexpected. That's like really valuable insight. Huh.
It is, yeah. So that's kind of why I was like, dude, we got to hop onto this, because at the end of the day, I don't really know the value on the TikTok side of things, but I'm starting to see the value of like these Instagram. We'll see kind of how it goes.
It was funny because I just tried to live stream. I got the Meta glasses and I just tried to live stream my run before, and I think it worked, but it kind of comes in and out, and then I don't know. You can actually connect the Meta glasses to Instagram and then headphones to Spotify. So it more or less worked. It's just I don't know. I got to feel out what I would want to do for a live, because I don't want to annoy people. But yeah. I don't know. Just trying it out.
It's something different. You might as well try it and see what happens.
Right. Yeah.
We got a question. How difficult?
Oh man, we got a few in here. How difficult? It's pretty difficult to match into OMFS. Another one. Sean Enheim. Does research help the CV when applying for OMFS residency? It can help, but I had more interviews ask me about playing the violin than my research when I was applying to oral surgery. So it can be unexpected.
Play the violin, I like.
Yeah. Did you play an instrument?
I'm serious, because I don't play any instrument.
No?
And I think literally my parents never put me into any of that towards it, but I have tremendous respect for anybody that plays any sort of instrument.
Oh, the good old recorder.
Are you facing on collecting money from the insurance companies? So I no longer own a practice. They are well equipped to deal with if your narratives are to appeal those rejections are not on point and you're not requesting peer-to-peers, then you're going to have issues collecting. So I think it's how your staff is trained. And yeah, I mean, pure dental billing, if you want to, I do a lot of marketing and work with billing companies to help connect them to dentists to onboard, so you guys can onboard them as a client. So send me a DM. So what did you do, man?
In dental school, I mean, studying for that CBSE is definitely a lot. Extracurriculars, I loved ASDA. I loved being a part of ASDA. The events made it everything. Going to the ASDA annual session where you get to meet other dental students throughout the country and basically you go to meetings all day, maybe not, but then you party every night. Those, yeah, exactly. But wait, really quickly. So you said you really liked growing up, people playing instruments. What did your parents have you do growing up? What did they get you immersed in? I wanted to ask you that. What sports?
You didn't really have to.
Yeah, it is a lot of times. Yeah.
I think it opened.
Oh, you mean like the sports too?
No, instruments.
Huh. Because I definitely think sports plays a very important, foundation. It lays a very important foundation as far as a team-based atmosphere, working as a teammate, not always an opponent. I think it sets the foundation for that. I met many in dental school that didn't have that understanding. Because they only had the one orchestra or band instrument, and it's you playing your instrument. But you get it. You know what I'm saying?
Yeah, man. I think working in high school and
yeah. And actually, it's funny you mentioned that. I couldn't agree more. I worked a couple jobs in my gap year in between college and dental school. And when I got checks, I worked at Bristol. It's an assisted living home all the way like a couple towns over one way, lifeguarding. And then I worked at the gym lifeguarding, and I did another couple jobs. But when I got the checks from both these places, a gym and an assisted living home, multiple towns apart, the signature on the check was the same person. Do you know what that is? That like the bank or?
It might be the bank. It might be the state. Something to do with the signatures from the boss. Whoever was the boss. So that's kind of odd. I don't know. It might be. What state was it in?
New York, on Long Island. But it's funny that you mentioned that because you usually get the check and it's signed by the boss. And the boss, when I was a surgical assistant at an oral surgeon's office, it was signed by the head oral surgeon or like the partners. And then when I got it from a gym and from the assisted living home, I'm sure someone's got like some simple explanation, but that just kind of blew my mind when I'm like in height, just getting out of college, and it's the same person. I'm like, what? Why? I want to be on this check. What? It's going to come down to, extracurriculars are important, but actually, and I did lifeguard on Sunday mornings in dental school. That's not what stood out though. You got to get the CBSE out of the way, because that's how these residencies can compare to all the other dental students in the country. And then within your school, they want to see good standing, whether that's your GPA, whether that's your ranking, good letters of recommendation. And then last but not least, some people, they do a lot of research to stand out. My thing was more, I wanted to get a good trail of externships. I did do research, but my externship trail was smack in the middle of COVID. I happened to still land 3 externships at Montefiore, VCU, and NYU. And that, I think that's what stuck out on my application. So when I applied, I don't know, they were asking about the externships, and I was telling them like, yeah, it was in the middle of COVID that summer. So anyway, I think that's what it was. And I was able to talk kind of the same language because of those externships on interviews. But you gotta stay your course. You don't want to do things that's outside of like your comfort zone. You do, but don't just gun for the number 1 spot. I guess that's what I'm trying to say.
School did I go to? Yeah, so
that's right. You went to Detroit. That's a big school, isn't it? Isn't that like,
dude, way too big?
It's like 270.
70? No way, man. It was 140.
And it's gotten a lot bigger since then too, I think, right? I gotta check. But
I wouldn't be surprised if they added a couple. I know they didn't they maybe did. And I think Tufts and NYU.
Yeah, 144. Detroit Mercy's it's probably a little bit higher right now, but I got 144 on the pre-net mentor map. So that's some data some live data.
Can you pull up what are the biggest?
Yep. Oh, NYU is 400. NYU's 400. Yeah, good question. Tufts is 200. Yeah. There should be a way for. Yeah. Here we go. We could filter based on class size. Let's see. 100 and above. How do we filter this? Apply. But this is actually interesting. Let's see what we got here. Arizona Midwestern 140. I didn't know Arizona Midwestern. USC Herman Ostrow of USC 144. So right around Detroit Mercy size. It didn't put it in order, unfortunately. Yeah, Detroit Mercy, Pacific 144, and then I'm just curious real quick. UPenn 120? No way. Mississippi 140? All right, anyway, let's get back to this. I'm just surprised at how many dental schools had so many students like that. Yeah, there is. We intersect in a lot of areas, but mandible, it comes down to politics in a lot of areas, but like the mandible generally goes to oral surgery. However, we just rotate facial trauma at the Level 1 Trauma Center in Manhattan. We rotate every 3rd day on facial trauma. So like a couple of days ago we were on, and then the day after that it was like plastic surgery, and the day after that it's ENT. So when it comes to trauma, the facial region, it it rotates in a 3-day cycle. Otherwise, like orthognathic surgery, there are ENTs and plastic doing that, but generally, orthognathic surgery is based predominantly on like the teeth and the occlusion, the aesthetics of that, and the alignment of the face. Generally, I mean, maybe I'm biased, but I would probably go more towards the oral surgery end versus nose jobs around the eyes, the ears. I'd probably go between plastics and ENT. You know what I mean? And yes, there are oral surgeons that do the nose rhinoplasties. They fix up ears. They do plastic surgeries, facelifts. They, you got Dr. Hannah in Manhattan, Hannah Face and Jaw. So yeah. And then Dr. Manalakakis, he does facelifts. He's in North New Jersey and I think Manhattan. So you have a lot of people doing all these different aspects in plastic surgery and ENT. But generally, that's I think I gave a good delineation. In the throat, many things probably should. If it is pathology related, I would probably send it to a head and neck surgeon that has experience with, on a daily, maybe not daily, but, routinely does these procedures. You have oral surgeons, you have ENT surgeons that are even plastic surgeons of the head and neck, but they do an extra fellowship. And you don't have to necessarily do this, but generally you see that these people, they do this extra fellowship training in head and neck surgery, head and neck oncology. So taking out cancer of the face, taking parts of the fibula, of the scapula, of this and that, and putting it into the face to replace that deficit of the tissue that was taken out, stuff like that.
Yeah, taking like vasculature from like the thigh to put it like into the, let's see.
That's dude, I've done like a couple of them this month. Within the last 4 weeks, it's crazy. It's so important that you're with a surgeon and attending, your boss. That's like a good teacher. That's very level-headed, treats you well. It's so important because that can make it literally like life and death for those 4, 6, 10 hours or more that you're in that surgery. It's so important. It can be a very good and a very bad experience.
That was a wild thing to see.
Yeah. Here we go. Tommy Shea. I dated a chick who did Paris Hilton's teeth in BH. It's a scene. What's BH? But that's a crazy comment. Well, I mean, I guess we're better off knowing now. I never would have thought of that, but that's a funny one. Yeah, I mean, you gotta. That's so true. You gotta push to get the highest GPA you can get, but don't let that attitude or behavior compromise your personality. Don't let it turn you into something where it's just, it's you against everyone else. It's like you need to have all the right answers and they need to have all the wrong answers. It's, the tactics of sending out a study guide with incorrect information on it. It could be you being really loud when you finish the test early. I've seen it all. And don't let that, it compromise your attitude. Don't have a bad attitude just to try and aim for the first spot or whatever it may be.
I agree, because nobody likes those people, and it's going to be very difficult. History is a very connected field, and at the end of the day, if you rub people the wrong way, when it comes time for you to be that surgeon, a specialist 6 years down the road, if you piss people off.
That's right. Tommy, that's a good point too. Nobody likes those people. Tommy Shea said you should be a good surfer too. All right. I was not good at surfing. I don't know. Surfing wasn't practice.
If you guys got, we are industry related, crypto, finances, how to get into dental school, how to get into residency, you name it. We're a wealth of knowledge.
Yeah. And then I gotta eat dinner in a little bit too. I haven't eaten dinner yet. It's getting late.
How is the world of insurance changing the dental scene? Yeah, man. We don't have to stay on this too much longer so you can eat some dinner. I don't know, maybe another 10, 15 minutes at most?
Let's do it. Yeah, that's perfect. That's perfect.
How's the world of insurance changing the dental scene? It's very different. So they are really drifting towards preventative services. So they're going to be covering preventative services, which are cleanings and all that type and exams, a lot more than they have been in the past, right? Also, what you're starting to see because of the understanding that periodontal disease causes basically every single problem in the human body, and it amplifies every problem. So your diabetes is worse, Alzheimer's is worse, your risk of heart disease. So you're seeing now insurances cover scaling and root planning, which is quote unquote a lot more than they have been 5 years ago, 10 years ago. They are really not even denying that anymore because they know that link is there. Yeah, so that's a good thing. I mean, especially for hygienists, because in the past you do treatment and they would shut down that SRP, and now you got to basically fight for it, right? So you're having that basically be a thing. Certain insurances, Humana actually being a pretty good one in my opinion, they're giving patients just like a stack of cash that they can just go to the dentist with and be like, they can use that kind of like you would for an HSA card, but it's like dentistry specific that they get that they can use for literally anything and nobody can tell them otherwise. It's wild. I've seen that a couple times and I think you're going to start to see that a lot more with insurances. There's a lot of good and there's a lot of bad. Obviously the bad being reimbursement rates for dentists, but in terms of like patient care, I think what you're going to have happen is the care for the patient is going to continue to get better, and dentists are going to be continuing to be reimbursed worse. It depends on your biller. Are they implementing any type of dental business courses? What are your thoughts on that? You kind of have to expand on what you mean by dental business courses. Change how you would run your office or what cases you take, refer out. To be honest, yeah, like if you have an oral surgeon or a periodontist that comes into office or just any type of specialist, there are certain insurances, particularly like HMOs, that they will pay GP absolutely nothing to take that tooth out, but they will pay the specialist a decent amount of money. So now you're looking at it, same thing with root canals, and now you're looking at it, okay, well, I see that insurance, I take it, right? I'm just going to have my specialist do the root canal or do the extraction. And you see that happen a lot. And whether you think that's a good thing or a bad thing, I can't really comment on that. But there are decisions that are made in that regard. But, at the end of the day, it's like if you're taking a tooth out for $4, which is something that you see, and it's something that is going to take a little bit of time, and they're not doing bone grafted membrane, what do you do at that point? Like, you get yourself in a situation that this extraction for $4 is going to take 45 minutes or an hour as a GP. It's at the end of the day, and complications can be a lot higher because they don't want that bone graft and that membrane, and they're going to have pain, and you had to remove a lot more bone. There's things that people, they don't really sit in front of the computer for 30 minutes to make that decision. It's a split-second decision, but it's a decision that's made nonetheless. In other words, I help startup dentists, and so many don't know how to bill or what numbers to look at, or an associate, and the dentists don't realize they're paying them for the wrong report. Yeah, I mean, that's an issue. It is a big issue. I think at the end of the day, as a young doc who's just hired by a practice owner, I mean, sit at the computer for 30 minutes to make a decision. I mean, there are some people who they really dwell on those types of things, and at the end of the day, it's like, you shouldn't. Yeah, most insurances, they don't cover membrane with extraction, so that kind of comes out of pocket, and that's what I'm talking about. It's like you're doing that extraction for $4, $5, $10. Like, there is some insurance, but the patient doesn't want to do bone graft or membrane, then you're kind of in this situation of like,
yeah. I'm having trouble seeing the new comments come in. It stopped after the Tennessee one. I'm not getting any new ones. Yeah, they stopped like showing up on my screen, which I'm just confused by.
Yeah, or favorite OS surgery. All right, man, that's you.
I would probably say somewhere between like all on X cases, sedations, wisdom teeth. I mean, all the wisdom teeth are different, and when they're like easier ones, they come out so fast that everything else is longer than it, which is it's cool. It's fun to see that. But yeah, I guess I don't know. I enjoy taking out difficult teeth. But yeah, I don't know. It's dude, the beard's coming in great, by the way.
Yeah, it's gonna be gone tomorrow morning. Beard, it's rare to see these.
Who's it? No.
What's the difference?
What's the temperature like right now?
Oh man, it's like 80 or high 70s. It was cold this past week, but
I don't know how you do it. That's way too hot. That's way too hot.
my favorite that's everything, and deliver those immediate dentures, and we go from there.
There we go. That's a good one. What do you got? Is that wine? Is that red wine? You're having coffee right now at 6 o'clock at night over there? All right. I'll stop playing,
Yeah.
Mom. If you were having red wine, you could have almost convinced me to open one up.
Materials for fixed hybrids. I mean, you kind of have to expand on that because, I mean, so like, I have my surgeons do all on fours, right? I will do the restorative part, they'll do the actual surgery up front because I know how good this lab is. I've worked with them, and it was kind of like me being referred to them. So their level of expertise is next level. They send somebody out the day of surgery to do the immediate load. So I've never had an issue with that. I think it's more so if you don't have a working relationship, one, if you are not recommended to that somebody that you trust very well that has a working relationship, and you're just trying to try somebody out for the first time. I mean, at the end of the day, you kind of have to, right? Or you can do kind of like a pay as you go and ask them for like every step of the way, but it really gets kind of finicky at that point. I think word of mouth and finding somebody that you trust or somebody that you trust as a dentist that trusts a different lab. I think that's how you can kind of remove a lot of that headache. Thank you for all your guidance, Dr. Gallagher, during UC Berkeley. He's a legend, man. He's a legend. How do you like practicing in a city like Vegas? I love it. I think it's the best city in the United States of America. What brought me there? Working opportunity. I had a couple different opportunities lined up. For me, it was always a place that had no state income tax and that was projected to grow. And it was Texas, Nevada, and I went to dental school in Detroit. Obviously, staying in Michigan was an option as well for me. So that's kind of how I made my decision, and I ultimately decided on going to Vegas because I grew up in SoCal, so my parents were close to Vegas. It was a lot easier to see them, and then just the things to do in Vegas, the food, way better than anywhere else. Cost of living was relative expensive for everything else. Yeah, NYC was not on my radar at all.
Why did you pick Detroit Mercy Dental School then? If you're from Cali, just curious on the pathway, you know?
Yeah, man. So for me, I always this is going to be the last opportunity I kind of have to be, quote unquote, a child with not really that many responsibilities. As a dental student, at the end of the day, you're getting government money to live. All you have to do is focus on school, right?
Yeah.
And I wanted to kind of put myself in a situation that was different, a little bit uncomfortable, where I'm forced to kind of grow as an individual in a different part of the country. Right. And I said to myself, I'm never going to have this opportunity again with kind of that no strings attached of being a student. And I'm always going to have the tie back to California because of my family and my friends and the networks that I have out there. So if I ever wanted to go back, I'd be able to do that. Right. And lo and behold, fell in love with Michigan, with Detroit, with the people there. Myself, I learned a lot about the country as a whole in terms of just how different people are from that California bubble. I wanted to get out of that bubble, and so I pursued that.
That's a great point. Did you ever go to Grosse Pointe in Michigan?
It's attached to the Great Lakes, right? And it's kind of right in between Canada and Detroit. And so I would go there every once in a while. It wasn't too far from where I lived. And I would just kind of stay and chill and just like look off into the lake. It was kind of this, I would always go kind of like early afternoon, and there's this like one bench that is just like covered by like trees, and it's like in front of this like preparatory high school or something. Go there and just kind of chill and look off into the lake. Like 6 o'clock, 7 o'clock in the afternoon sometimes, and just ponder life, think about the things that I need to think about. And it was like the greatest view. Like still to this day, I think very few things that I've seen like kind of beat that. It was just calm, serene, green trees. School kind of reminded me of like a Harry Potter type of vibe. So like it was just kind of like I don't know, just very green.
Better view than Las Vegas?
Yeah, man, Vegas is just a desert. Like, there's a lot of cool things to see here, but like the California sunsets, those were nice. And it's the lakes.
I went to Grosse Pointe. I had a friend in college that was from Grosse Pointe, Michigan, and so we went back to Detroit. Went to his house, and this is a guy who came from a very nice family and everything. And at the time, it was like number 5 top neighborhoods in the country or something. And I went to his house, and he's got like this thing's big, but One of the things that stuck out to me was he had one of those lawns, of course, right on the lake, this huge back lawn, and the lawn had designs in it. Now, I'm not talking about like when you're watching a baseball game and they got like the lawns mowed with different like lines and stuff. I'm talking about there were designs, patches of grass, designs in the lawn, separated by like rock and gravel over here, and that was the lawn. So it must have sucked to mow this lawn. Yeah.
And obviously, every dentist where it just snowed like crazy. Like if you were a true baller, like they said, what you would do is you would install pipes that so you can run sheeted water underneath them, so it would melt the snow, and you never.
Yep.
At the time, it's not like obviously now, yeah, they were saying it was like over 100. Yeah, but then as soon as you get off your driveway, like there's all this snow.
Yeah, I've seen that a couple times. That's pretty awesome when you're the only driveway through the snowstorm that has no snow.
Snowboarding, went and had a beach bonfire. Yeah, that was pretty cool.
That's a really good day right there. That's a solid
20 years later. So
yeah, a couple beers. Yeah, let's go back to the Q&A. Let's go to the Q&A.
And do some dental schools have a higher rate of specialization after graduation?
They do. I would say they do. We're slowly adding those specialization rates. You have to look at the percentage because you could have a big dental school that has, say, like 10 match into orthodontics in a year. But if it's 400 students, do the math, right? Versus, say, Stony Brook Dental School, let's just do something that I know. It was 44 in my year. And in my year, we matched 6 into ortho. So 6 over 40 versus 10 over 400. The rate, like, yeah, there's more students that got in NYU in this example, but the percentage was better at Stony Brook, and therefore you have a better chance of getting in. Now, you don't want to pick a dental school based on your percentages of getting into a specialty. I think you want to pick a dental school based specifically on clinical experience, because then you're going to get better exposure to all the specialties, and you're going to have a better decision-making capacity, as far as what specialty you like or not specialty, right? Because that's important too. UCLA is generally pretty good, yeah. Yeah. A lot of the Ivies are good. Columbia, Harvard, UPenn, year after year, they're generally, and then generally the smaller schools and the unranked schools, just from my loose observation. But, we did create the pre-net mentor app, and I kind of look at it over the years. Yeah, it's interesting to see these things. The one thing that's missing, we're slowly adding on the match percentages of 2025. How many matched into this specialty, that specialty. I think it's really important for pre-dental students to know this stuff. But Pat, get this. There are some dental student schools that we're facing now, or I guess facing indirectly, not like aggressively, but they don't want the match numbers to be released to the public. Oh, that's not public data. That's not, we don't make that available for the public. You didn't match into the specialty, your students did, and that's their information, that's their accomplishment. How can you take ownership over that? I don't know. It seems to be a little bit too much control to me. And transparency is a good thing, especially for your future customers in a way, right? It's dental students. Yeah. No, especially in today's day and age. I mean, $120,000 a year at NYU, like these Pacific or UOP, one of those is the same thing. We're customers.
At least UOP is 3 years.
Yeah.
If you did.
Right. And then it's like, well, whose fault is that? That should be released to the public anyway,
It should. I mean, definitely if it's public schools, I believe. I can see why, which is kind of, if they get any sort of federal funding, I think they should be required, even if they're private school. And I think pretty much
Right.
Everybody joining in, we'll probably do this for about another 5 minutes or so, and then we'll be more than happy to answer random things that kind of cross our minds. So dentistry, finance, dental school, residency, working as a dentist, whatever it is, we're here to answer. Yeah, man. So what do you got planned this week?
Oh, this week we did a BSSO on Friday, some orthognathics, but this week,
nice.
Simpler case on Friday. Oh, and all on X on Wednesday.
Nice.
At one institution. What are you? Any good case? I think it's one arch. I think it's an all on 5 of the max. I think. What about you? What do you got? Any good cases?
See if we can get anything to convert. I have a couple people.
There we go. How's he doing?
What's he doing?
How's he doing? I want to see. If I can't see the chat. That's right. He put up a post the other day that, did you see this thing where Delta Dental was allowed to speak for a couple minutes or a minute at some event to dental students? It was like a mandatory meeting, and then they opened up the meeting. Did you see that? That was Dental Nachos, right?
I did see that.
What's going on? Why is this conflict of interest? It's just so inviting. Why is everyone welcoming conflict of interest?
We talk about that because I think it's BS. I know BS. And more and more, like you're saying, these placards get paid by Delta Dental. I mean, do what you got to do, man. But yeah, man, it sucks, because it's not fair for the students at the end of the day, and especially when you have these mandatory things.
Yeah.
I think it's smart on the dental school side, right? Because they're getting.
Yeah, but like, what the heck? I mean, Delta Dental, they could afford to open up a clinic at UIC, but they can't put a crown on grandma's molar?
Let's say Delta Dental set up a dental school, fully funded, where they taught dentists the ins and outs of dentistry, just like Detroit Mercy would. Whether you want to go to that school or not, that's on you. But I think it's when the dental schools and the dental insurance companies start to collude and have these partnerships, I think that's where things get rare for students.
Yeah, because then the teachers at the institutions can be they're full. But then no, I disagree with you. I think both of them are equally as bad. You got High Point University being opened up by Workman. That's that DSO down there in North Carolina. The High Point University, it's Workman School, and I know who they collaborated with to make that open. But that's a DSO opening a dental school. That's just conflict. You can't teach students to just all be produced, and then they're going to have hundreds, maybe even thousands of offices at this point that they could just place students into, and that's a whole conflict of interest cycle. And now here's the thing that decreases the allowance of competition. And competition is good in any industry to an extent, not malicious competition, but competition to make things grow better. I don't know. Wow, I never thought of that. That's an interesting thought. But then you have to serve in their companies for interesting. No, that's a really good point. I didn't consider that.
Middle school is really expensive, and I don't necessarily agree with it, but I think it does have very striking similarities to going down the military route. Curious what your thoughts are. I think that's something that's unique. I know hygiene programs DSOs are looking to do some things with that for hygiene programs as well.
Oh, I'm sure they are. I think one thing with the military, though, is I could be wrong. I'm trying to theorize and really, think about this. In the military, you go to training and stuff, but that's what I'm trying to think of similarities. And when you think of the military, you could get education within the military that's of the trade. So the trade would be dentistry. So you could leave the military and then hop into dentistry. If dentistry is the military, where can you go? You know what I mean? If you're in the military and you still get your education, your education might be in, political science. It might be you could go into law, or you could go into dentistry, right? You're still getting that education, which is what you can hop out of. If dentistry, the trade, is that military, right? You're saying how a school funds the entire education system. You're learning, you see what I'm saying? You can't leave. You can't get out of the system. Does that make sense? Right, but it would still be in dentistry because you're a dentist at that point. You're not.
Yeah. It's like but it's like the military. You're not paid $1, and I don't have any plans to do so. And if I would have, I would be in a lot worse situation than I am today. Nobody really pays anything. I mean, I don't know the exact numbers of like people who have not paid off their dental, not even dental school, just student loans in general. And the way I look at it and how I think about this in my head is all the BS fraud that's being found that the U.S. government has been spending money on and sending overseas to wherever. It's not fair. So I am not going to pay back any money at all. And I know a lot of people are looking at things like that as well, and they don't come after you. They don't. Whatever anybody says in terms of them coming after you, they don't. They can't do anything. The ones who did ruin it, though, were medical students years ago, because they would all file for bankruptcy as soon as they graduated medical school, and they would file for bankruptcy so their student loans would be wiped clean. Get your student loans wiped clean, because every doctor was doing that, and dentists too back in the day.
Wow.
Which I think was smart. Why not?
Huh.
These banks that weren't done, they were like, oh yeah, like now he's clean, yet he's got no debt. We'll go ahead and we'll give him. But I think that stopped like 20 years ago for you. I
man.
Take care of a couple things. But
yeah, my phone's at 10% now. You too, man. Always good talking. This is we said 6, right? Part 6. There we go. I know we didn't get a few out there. It's somewhere on my computer recorded, but I forget what happened. But hopefully this one we could get out there.